All right, good morning, everybody. It's 8 o'clock. We will call the Douglas County February Board of Health meeting to order. Um, we have 5 here as a quorum, and I don't know who may be on through Zoom. If you want to make that known somehow through the chat so Sunday can check it, we'll go through that if any members or ex officios are there. With that, Sunday we call there's a notice of the Open Meetings Act here on the south wall of the room, and we have official public notice, so roll call.
Okay. Espinoza? Here. Wilson? Here. White? Here. Here.
Here.
Great.
Here.
Item 2 is approval of the minutes of the January meeting. Is there a motion and a second?
So moved.
There's a motion by Gray, second by Wilkin. Roll call.
Rogers?
Yes.
Wade?
Yes.
Espinoza? Yes. Wilson?
Yes.
White? Yes. Great.
Yes.
Public comment. Are there any public comments here in the room or outside at this time? Seeing none, we'll move on to item 4, which is approval of action items. There are 6 items, 4 applications, 2 agreements. Is there a motion second?
So moved.
Motion by Gray, is there a second? Second by White. Roll call.
Gray?
Yes.
Rogers?
Yes.
Wilson? Yes. Espinoza? White? Wade?
Yes.
We'll go on to item 5, which is the health director's report and issues of discussion by the board.
Good morning, Board of Health members. And my first update is a little bit about the legislation. Things are going really fast because they have changed the order and are doing public hearings in February, and that should be done actually with public hearings by the end of February. I have put a sheet on your desk with all the summaries of all the bills that we are following. And you see the action items there. The F means we are following those bills. And on the first page, LB 115, I had our lobbyist talk to Senator McAllister. This is imposing a sales tax on candy and soft drinks. And we wanted to have some of that revenue appropriated to the healthcare cash fund, but specifically to public health. So he has had a discussion with the senator about that. The hearing of that bill is next week. I would like to send a letter in support of that bill, and I think the board has approved that last time. On the next page, we don't have any action. We'll follow those bills. But if you go to LB 396, this is the adoption of the Nebraska Farm to School program, and the board also approved to send a letter, and that hearing is next week also. On the next page we have LB 553, and that is what I lovingly call the bedbug bill, and that is only effective for areas of the metropolitan size, so it really only affects Omaha. And what we are seeing in that bill is the same bill as last year. It references that employee health, environmental health specialists from local health departments would follow up. And I think in our comment we are saying there needs to be training of these individuals and also actually funding for that training, because at this time our environmental health staff is not certified to look at pesticide applications for bedbugs. This is purely written for the pesticide industry, and therefore public health, to put public health in there is really is not appropriate at this time, because our staff does not have the training and we do not have the staff to do this at this time. So we sent that letter to Senator Wayne. The next bill is LB 584. You approved that also. That is the same bill, again, Senator Vargas. It has to do with the food truck bill, as I call it. It has to do with reciprocity. It's the food truck owners who are saying we do not want to have certification of each of the city where we are going in. There should be some reciprocity. And I think us in Lincoln Lancaster have talked to Senator Vargas about this, that yes, reciprocity is good between the large cities like Omaha and Lincoln, because we know our environmental health staff does inspect our food trucks here, and Lincoln Lancaster County Health Department does the same thing down in Lincoln. However, we are concerned about food trucks who are coming in from smaller communities where the inspection process is not as thorough, and they are bringing in food trucks in our community that we therefore cannot inspect. So we are working with Senator Vargas on that. The next bill, LB 585, which will provide funding for local public health again. It's like the second phase of the bill that Senator Vargas introduced last year. And we will have, especially Pat Lopez, the local health director from Lincoln, she will be testifying at this bill, and we probably have another 2 health directors testifying on this bill, as well as letters of support that we are looking for right now. So that hearing is next week, and I would say it's probably one of the more important bills for the local health departments. The other bill is LB 637, and that is the bill that would change that we do not need to have authorization from the state if we put public health measures in place in regards to infectious diseases. So this bill is in hearing this Friday on the 19th, and I will go down and testify at that hearing, because I think we as a city, we saw some of the difficulties, but it's also not just what we are experiencing now. I give you an example. Early in my career here, in I think 2005, we had an individual who had active TB, and he needed to be, it was he at that time, he needed to be observed for direct observed therapy because he was infectious. But we couldn't find him, and he would always we found him one day, and then he would be gone the next day. So we had a judge present an order and actually did a due diligence, so to say, hearing with this individual. Before I could do the order, I needed approval from the chief medical officer at the state. And at that time, and I had a very good relationship, I informed and I got immediate approval. You know, it shouldn't depend on the person that is in the job. It should really be a local control for it to say. So that's why that bill is important in my mind. I think City Councilman Gray would tell you how cumbersome it is if you have to go through ordinance to get some of these public health measures approved. So that's LB 637. LB 643 is, it gives individuals the right to decline vaccinations in general. This has nothing to do with COVID. This could be measles, could be vaccinations that are now required to enter schools. So that hearing already was on the 4th of February. And you may have seen in the paper, there was quite a large group of individuals which we call that they are against vaccinations. However, I think you all remember the outbreak that we had in Disney World a few years ago, and also smaller communities who are not vaccinated appropriately, don't have herd immunity, how easy it is for an outbreak of an infectious disease to happen. So that happened. Pat Lopez actually was in opposition to that bill. It was very disturbing, I think, what happened at that public hearing. And the last bill we are just following, that is the bill to observe enhanced penalties for violation of directed health measures committed by a public official. So that's kind of where we are standing. Really an important week this week, at the end of this week, as well as at the end of next week. And after that, in March, I assume that the floor debates are going to start, and we will observe, and we will respond when we get requests from senators who need to have more information or need to make sure that the information that they are hearing on the floor are correct. So that's kind of where we are at this time in regards to legislation. Are there any questions?
For LB 585, what is the potential opposition there, other than just the additional funds?
585.
Appropriate funds for local public health, where you're requesting?
No, that is support. We are.
Yeah, yes, I know. Who is
Well,
opposing?
I don't know who could be in opposition to it. You know, that's always a difficult part because there are many people who want more funding for their programs. So usually what you are finding in these bills, there isn't any opposition usually. So we are looking actually for, and thank you for the email, for the proposal to really get letters of support from some of the organizations that we as local health department are funding. And you know, it's easier to fund those organizations if we do get more appropriation to the health department. So we'll reach out to all of them. We already, I think, have reached out to the Nebraska Medical Association and so on. You know, public health has had a difficult time the last year, but we have also made a lot of friends. So I think a lot of people are recognizing how important it is to have a public health system that is well funded and that is strong. And so I do foresee that there was no opposition actually. It's always a budgetary issue. You know, people say, well, we don't have money, we don't want to spend. So that's really usually the opposition you have on these bills.
Dr. Ford, what's the history of, I still haven't figured that out or haven't been able to find out, LB 645, penalties for a public official that doesn't follow direct health measures? What's the...
We didn't, nobody could really find out. And when you read the article of, I think that's Senator Hansen's bill, he was asked why he was introducing this bill. And I think his comment was, it is more a protective measure. I don't have an example that this is occurring at this time. So.
Okay, I don't think there's any other questions.
Okay, then let me go over to the Covet report. And as always, I want to start out with some of the data. And as of the data last night, we have tested 56% of the Douglas County residents have tested for COVID-19. And 11% of the Douglas County residents have been positive. And that's 62,788 individuals, and of those, 51,096 have recovered, fully recovered. So potentially we can say at this time there are 11,692 individuals who have recently been diagnosed or still have lingering effects of COVID-19. Our 7-day rolling average, that's usually the measure that you hear across the nation, is at this time 18.4 new cases per 100,000. I just want to remind you, in November, that number was 111.5, and now it's 18.4. We have seen a significant decrease every week from that day. Now, last week when we look, what is a little bit surprising is our testing has really decreased. And our testing last week, we had 4,039 tests. This has been the lowest week since May 6th. Our cases also have been low. We had 889 cases which is the lowest since September 26. Again, I think a consistent decrease in cases from week to week we are seeing at this time. I just looked at it a little bit about race and ethnicity, and we have now about 61% of the cases that are in our white population. Blacks make up 9% of our cases, Hispanics 24%, and Asian 5%. So the only disparity that we still have is in the Hispanic population. Our Hispanic population is 13% of the general population in Douglas County, but in regards to the COVID cases, they make up 24%. Our positivity rate, when we look at test over test, meaning if you have tested 10 times, you are in that database for 10 times, that positivity rate is 5.6% at this time. It's also on the decrease. When we look at death, we have 639 deaths in our community for a case fatality rate of 1%, which is still one of the lowest in the nation. I think when I looked at the New York Times on Sunday, it was like the 14th lowest of all the states. So when I look at the deaths and look at race and ethnicity there, it is a little bit different. There, our whites make up 75% of our deaths, blacks 9.5%, Hispanics 11.7%, and Asians 1.6%. So there, the disparities is in our white population. They are disproportionately affected by them, because they make up 68% of our population, and they are 75% of our death. You know, I think everybody has their favorite emails that arrive, and for me, the favorite email is the one I get now every day in regards to hospitalization. I cannot tell you how happy I am when I'm looking at that data. We have, as of last night, 102 inpatients with COVID or related to COVID-19. That is a decrease from a high of 445 cases in our hospitals. We have 49 of those 102 inpatients are in the ICU. Potentially, you could say 50%. 1 in 2 is in the ICU. And we have 19 of those individuals on ventilators. So 1 in 5 on ventilators. And I'm following those numbers very closely, because I think what we need to wonder is, do we see a higher acuity in patients who are now hospitalized than we saw in the beginning or at the height of this? Our dial is still in the high orange area at the 2.8, not in the highest extreme, not extreme, but still 2.8. Because I just want you to share, as nice it is, our cases decrease, they are at September level. Remember, we are not down yet where we were in summertime. So I think we need to keep that in mind. But now I also do want to talk a little bit about vaccination. And as of last night, we administered actually 95,636 total vaccines. And of those 95,000, 72,957 are Douglas County residents. So that means 22,679 are non-Douglas County residents who were vaccinated in Douglas County. Most likely, those are healthcare workers. And you know, when hospitals vaccinated those individuals, they do not ask, are you a Douglas County resident? But you get vaccinated because you are a healthcare worker. The same thing goes for first responder. The same thing will go for teachers. If you do occupation, it matters that you are in that occupation group and not that you are Douglas County residents. Now, for seniors, that matters a lot. Seniors can only make an appointment in our scheduling system if they are Douglas County residents. And that is, again, to make sure that the allotment that we are getting in Douglas County is appropriate. In total now, when you look at 5.44% of our Douglas County residents have been totally vaccinated. What I found interesting too is and now I'm only talking about Douglas County residents, when you look at those, 70% of those who have been vaccinated are females and 30% are males. I found that kind of an interesting statistic. When you look at race and ethnicity so far, white 78%, black 5.4%, Hispanics 4.8%, and Asians 3.3% of those who have been vaccinated. When you look at age, it's also, I don't know if I would have suspected it if I wouldn't have looked at the data. The highest age range that has been vaccinated is 20 to 34 years of age. So I do have to assume, it's that workforce, those healthcare workers that really are falling in that. That is followed by 25 to 44 years old, 55 to 64, 45 to 54, and so on. I just want to give the board a little bit an overview about our community clinics. You have now heard we potentially have 5 or 4 and 1 specifically for our South Omaha communities. These are community sites where individuals can get vaccinated free of charge, but only by appointment. And we have the site at 144th and Miller that is led by Nebraska Medicine. We have the site at Christ Community Church on around 108th and between Pacific and Dodge that is staffed by our staff. We have the site at Creighton, the Rasmussen Center, staffed by Creighton. We have Emmanuel Hospital, staffed by CHI, and we have the Kroc Center that is also staffed by Douglas County Health Department residents. So I just can tell you these sites are working really well. They are now starting to get into second doses, which means, the amount of people that they are seeing is doubling because they still continue with the first doses, but now second doses are coming in. So last week, we got a little bit of surprise about this federal pharmacy program, and we got 2-day notice, actually, that the feds are sending vaccine directly to 3 pharmacies in Omaha. 33 or 43, depending on how you are counting, across Nebraska, and 3 of them in Omaha. One of them is the Medicine Man on 156 and Pacific. The other one is Think Whole, which is at Exarban Village. Then via REAX, I really haven't heard about them, 925th North 90th Street. These pharmacies are receiving direct allotment from the feds and around 130 doses a week. Now, what the governor was able to do at the last minute is really try to determine that these pharmacies also should follow the prioritization that the local health departments are using, and therefore it was also recommended to them that they only vaccinate seniors at this time. And he made it so about 65 and above because counties are in different age groups yet. And so he said, overall, you vaccinate you pharmacies, you vaccinate seniors above 65 years of age. And then next week, potentially, we will have a federal program with the federally qualified health centers. This is also a program, and you may have heard, if some of you have listened to President Biden last night, he kind of said it in between the lines. He wants to make sure that minority populations are getting enough vaccine, and this is one way to directly supply vaccine to them. We are already supplying vaccine to the 3 federally qualified health centers, Charles Drew, One World, and to Fred Leroy, and we are asking them how many doses do you need in a week, And whatever that is, we'll transfer it to them. And you will hear the two FQHCs talk a little bit about their program today. For this week, we have 13 different clinics set up. I think it's important for U.S. Board of Health to know this is across our community. This is what the community wanted. We didn't want just one mass vaccination site for one day a week, but really have it stretched out. So potentially 6 of the clinics are for seniors only. 6 of the clinics another 6 are second doses, and 1 clinic is for long-term care. So that's an agreement we have with Coles Pharmacies to go to those long-term care facilities, independent living directly. So now I want to share something with you, last but not least. I would like to make the announcement now that starting next week, we are starting to vaccinate educators. And first, I want to say a few things. I want to make sure that the educators in Douglas County recognize how important educators are to us, the health department, to myself, to this community overall. We have always valued their efforts that they are doing. And that's why over the last 12 months, we have worked diligently on many different levels with our school districts, be it public, parochial, private schools in Omaha. So a few of the things we have been doing is, the first thing was to develop plans with superintendents to really make sure that schools could even consider to open schools for in-person learning. That started last March. Since then, every week we have been discussing it. We have looked at these plans. Some of the schools opened, as you know, earlier than others. Some of the others felt that in the community there was too much spread around it and it wasn't efficient and it wasn't safe, like OPS. They waited longer to do some remote learning. That was very, very appropriate. Then our EPI team is working with the schools diligently over quarantining, identifying new cases, trying to do contact tracing with them so that we could go into those schools and immediately identify new cases and who needed to be isolated or quarantined around it. The other thing we did is we proposed testing to all of the school districts through the Nebraska Department of Education and through the Public Health Lab. Every school district in Omaha had the opportunity to do testing. Some of them did not take it up, and some of it had to do that parents probably didn't want to have more testing, and also some of the teachers were reluctant to do that. We have applied data to the schools on a regular basis so that they could make the right decisions. There were 1 or 2 schools, and not schools completely, but classes that probably had to be closed for a week because there was too much transmission going on. But in general, we found, and I sometimes think as these MMWR articles that have come out that schools can open safely, sometimes I think they should have taken Omaha as an example because that's exactly what we showed. We were able to open school early when we had a lot of critiques about it. And people said, how can you do this? We did it because we had the non-pharmaceutical intervention, mask wearing for everyone, social distancing. These schools looked at their heating and ventilation system and so on. They did one way in, one way out, and I'm really, really proud of the school administrators, the teachers, what all they did. This was not easy. It wasn't cheap neither. Some of it needed to actually revamp some of their systems. But I'm telling this to the community so that the community really knows all the work that has gone into this. We always said we would follow the prioritization system because a prioritization schedule has been developed so that it is applicable to all of Nebraska. And that is what we have done. We have followed it very closely, and so have all the other local health departments. So for example, when I get a call last Friday saying in Washington County they are vaccinating teachers, my first call was to that local health department director saying, have you vaccinated everybody that is in that tier above the teachers? Have you vaccinated all of them? She said, yes, we are done. That's why we are now able to vaccinate teachers. She said, you know, we have one homeless shelter that has 15 staff in it. We don't have a jail like you do. So every county, I think people need to realize every county is different. And therefore, even so you make appropriation based on your community and the size of your community, you have different aspects in that community. And so I just want to make clear, 90% of our allocation for seniors, 10% for essential employees in these critical infrastructures. Educators are in tier 1. There is not another tier above it. Educators are in tier 1, and we now are at a time where we can vaccinate them. And we'll start next Tuesday. I do not like that this actually has become a political issue, because I do not think it helps this community. And I want to make sure that everybody understands that I make this decision not based on political input. As a matter of fact, probably the saddest email I received was on Monday, after the media got a hold of this letter from some elected official. And it was from an elderly woman. She says, Dr. Kaur, I'm 68 years old. I have underlying conditions. I am waiting for my term to be vaccinated. I don't have a lobbyist. I don't have a union who can go to the elected officials and ask for favors. But I ask you for a favor. Don't give doses that are for the seniors to teachers. We have been waiting in line for this. And I had to assure this senior that we will keep the 90% for seniors and the 10% for critical infrastructure. None of these decisions now are made because of all the discussion we have in the community. They are based also on what I got last night. And that was actually a good email. It was an email that gave me what the allotment is from the state for us for next week. For this week, we had 7,250 first doses of vaccine for our community. 7,250. For next week, we are getting 10,660 doses. And this goes hand in hand again with what you have heard from the president. The president was saying, yes, they're going to make more doses available to the state. So just to also address one of the issues that I often hear. The state is receiving next week 36,620 doses. 500 of those they are taking away for their state facilities, which they are vaccinating, which leaves them with 36,120 doses. From those, we received 10,660, which according to my calculation is 29.5%. So this goes to some of the questions that we are receiving from many different people. That's what we are going to go forward. And, you know, I always feel we don't want to overpromise. I want to overdeliver. And that's what we are doing in this case. The next call late last night, was to Lincoln Lancaster. because it is important that we are staying in step with each other. What's happening in Omaha should also happening in Lincoln. And she was saying I told her, I said, we'll start vaccinating educators from our 10% allotment next week. And she says, I think we are doing it next week or the week thereafter, but thank you for letting me know so we can work together. And that's how it's going to happen. And that's how we are going to go forward. And I do not think it is beneficial if we have large, controversial conversations in our community. All of us are working very hard. I have teams that are completely overworked and stressed out because we want to do the best for this community, and we will keep on doing this. I'm proud of every single one of the person who works in public health, and so that's my report for today. Any questions?
Yeah, Dr. Ford, just a couple of questions, from me, and it relates to I'm sorry. Just a couple of questions from me, and it does relate to the teachers. Did any of the elected officials that engaged in this activity earlier in the week, did any of them bother to call you at all and ask what you were doing?
Absolutely not. And that's what I would have expected. I would have expected a phone call from an elected official, or I expect a phone call from all of you too. If you have questions about things, give me a call. I could have shared with them, yes, this is our plan. This is how we are going forward. And I do think that it's just much better to have these discussions than have this discourse in the media.
And did anyone ever say anything about, did they ever address with you all of the people that we have to take care of first, like the first responders and the healthcare workers and people that are in nursing homes and people who are in homeless shelters, and was any of that discussed?
Absolutely not. I had no discussion with elected officials in regards to the occupational priorities. No.
I may come back a little later, but thank you, Dr. Ford.
I had behind you, Chris. I had two questions. First one was around the percentage that's allocated to Douglas County. Is that based upon our workforce numbers or our resident numbers? Because we are vaccinating so many that don't live in Douglas County.
Yes, and that's a very good question, and the question that I pose often. It is based on our per capita. And the issue is, and we have, as local health departments, we have often discussions, because what you are seeing now is you are seeing that somewhere in the panhandle, teachers are already all vaccinated, and potentially one of their directors is saying, we are able to go into 1C pretty soon. I'm saying, whoa, why can't we stop? And why can't we evaluate? And especially since we have about 30% of our cases are non-DC resident. The question or the answer I hear from the state in that regard is, we do not want to stop giving vaccine to rural areas that are a little bit at a different pace. So I bring it up all the time that we actually are, and we are going to see this with teachers again too, that we are going to be vaccinating some non-Douglas County residents. So we'll bring it up all the time. I think that's the best we can do.
Okay. And then my second question is around the strains. So on the national news, I'm seeing that we've not had any of the UK or the South African or Brazil strains. And if I recall correctly, the last Board of Health meeting last month, they were just getting up the DNA testing for the strains. Where is that? How often are the strains being determined, et cetera?
Okay, since then, actually quite a bit of work has been done in that our laboratory, the Nebraska Public Health Lab, which is at Nebraska Medicine, can now do that the genotyping, and they are now asking for 100 samples every week to test, and so far have not found it yet. But that's really been a positive step in the right direction, because if you don't look for it, you're not going to find it, you know. And the earlier, and when you look at the New York Times article, you see Nebraska that hasn't had any variant strain identified yet. So I'm happy to say that that work is going on with the great partners we have at Nebraska Medicine.
Just a couple questions, Dr. Poor. Out of the 95,000 vaccinated stat, is that fully vaccinated individuals, or are some of those just first dose?
That's the total. That's first dose and second dose.
Okay.
We have it broken out. When you go on our dashboard, we now have
Okay, he's a man. And then, do you know, the last meeting we were talking about the Johnson & Johnson vaccine. Is there any update on a release or approval on that yet?
correct. So the latest update is Johnson & Johnson is going to go for EUA on February 26th.
Okay.
So after that EUA, you could say probably a week thereafter, if it is approved, it could actually be on the market. Now what we are hearing is the manufacturing is okay, but it's not so that million doses are going to be made available at the first in the first day. But they are hoping to really have that available pretty soon.
Okay. And then how are we on pace for the vaccines coming into the state? Is it about what was expected, or are we behind, or?
So that's a good, the process works like follows. So Wednesday, the state puts in an order into a national system called Tiberius. And those orders then will be filled by, be it Pfizer or be it Moderna. Then the shipment comes to the state on Monday, but it didn't come because it was President Day this Monday. Or then it comes on Tuesday. It didn't come on Tuesday because of the cold weather. So, you know, it's not, but what is expected is that the doses that are being ordered are coming in then the following Monday for that week. So every week a new order goes in. And those distributions are being made directly to the sites. So just if you want to know, our Pfizer vaccine, which requires ultra-cold storage, and we don't have it. We have an agreement with Nebraska Medicine. So all that Pfizer vaccine goes to Nebraska Medicine in ultra-cold storage. Every morning when I see some of my staff, and sometimes I'm here really early, and I say, 6:30, what are you doing? They say, well, we need to go to Nebraska Medicine. We need to get the vaccine so that we can get it out to the different clinics. So that's how the transfer goes. But that's a direct shipment from the manufacturer. Okay. And so that's a good question, because we are getting that. Now, in regards to do we get the accurate allotment, I always ask that from the governor too. Do you feel like Nebraska is getting the right amount? And what he says is he would like to see more transparency nationwide, what every state is getting.
Okay.
Good morning, everyone. I just want to thank everyone that is volunteering at the Kroc Center Clinic. I've heard very positive comments in regards to that clinic. A couple of questions that came through were, if one of the patients misplaces the card that's given to them, who are they able to contact to get that information to receive their second dose?
Yeah, it will probably be best to call our information line. Now, staff isn't going to like me say that because we do not, unfortunately, a lot of people are losing those cards. I do not understand. And, one of the recommendations is actually to take a picture of that card and keep it there for, but I would say to call our information line, 444-3400.
Thank you. And my second question is, at this time, are we vaccinating anyone between 18 and 65 with high-risk conditions or medical conditions?
No, we are not. And the reason is that those individuals also, they would follow after we have finished the seniors. So, and it is all data-driven, because when we look at the data, and I think I've shared that with the board before, 82% of our deaths are those 65 years and older. And then it goes, when you look at the very low, very young age, 18 to 44, very, very few deaths, which is perfectly fine. But that's why, when you have limited vaccine, you really want to give it to those that are most vulnerable.
Thank you, Dr.
Dr. Poole, before we go back around, let me make the statement, because you answered a lot of the things that I were going to put in the record, but I just want to say, to kind of sum this piece out, that I want to, it's been a year now, and I want to speak to the educators when I say this, and also to our staff, and thank them all for the hard work over the year. It's been kind of 100 miles an hour, pressed to the wall. It looks like we're seeing the light of some relaxation to some degree. And so I say that to speak to the teachers and say that I've had these conversations with representatives from them and told them that we work as hard as we can. And you all have showed that. So I just say that just as much as they are important in their cog, we've been working to make sure that's connected. And I say that because I am asking them that at no time during this has this department or the board shown anything but their interests. And we've been there from the start, from the summer of the mask mandate and trying to advocate that when they wanted it till now. And I am asking them to be aware of the players and give us some credit to the fact that we've been there from the beginning to the end, not just now. And that needs to be taken in effect, mentioning that all the players involved in this over the last 2 days, being a politician, I understand all the interplays, but this is particularly sensitive to me because we've gone through a year of where we've had politicians at high levels putting doubt into science, and it's put us to this point where we have doubts about masks and doubts about other things. My greatest thing, and I make this plea to them, is I do not want the Department of Health being used as a political straw man to feed into that continued dishonesty about science that's going out there. So that's my ask to the teachers. The people I told to, I said, be patient. You touched on all of that fact, and we're able to meet that need. And so I understand the push that you need to be for your people, and I wouldn't expect nothing less. But I ask you to give us the benefit of the doubt, because we've been there with you from the start, and we will be there with you to the finish. So I think I speak for the board on saying that, and if anybody else wants to say anything, okay. With that, I think we're good for your vaccine question. And I think you ready to go on to the presentation?
Yes.
All righty. Who's going to be up first? And Sunday, I would think you want to pin. Well, let's just do this. Let's go with, I saw Kenny. I don't know if Andrew was on, but if you want to put it in the gallery, and then pin Kenny for the presentation, we can go that route. Sunday, go to your picture. No, go up to full screen up at the top. Okay. Kenny, I would ask you get ready. We're trying to tee you up to be put into the queue here. Are you controlling this picture on the screen thing? From that computer?
I think I can.
Okay. So I would say go to your picture. Hit the gallery. Yeah. Okay. Now you see Kenny's picture. Pin him. Pin video. There we go. Okay, Kenny, you're up. Your pin and your face.
You're muted.
You're
muted.
I'm trying to hear him. I hear him a little bit. I don't know the volume.
He's muted. His mic is off.
So yeah, ours is I think it's hold on, Kenny. We got to get volume. His is not.
On this side?
No, his is clean. See if unmuting ours helps. I don't know. Yeah. Speak, Kenny.
Say check.
Mic check in. Give us a check, Kenny, to see how you sound. Can you hear me? Yeah. You're good.
You're good.
Good morning, Board of Health members. Thank you for the opportunity to share with this morning. I do want to start off by just sharing some of the sentiments Dr. Robinson about the work that has gone into this and the efforts across the state and here locally to ensure that we are doing everything we can to inform the population not only on the importance of the traditions that we talk about in terms of non-profit So I do want to, I know today it's going to talk a little bit about our strategy related to vaccines, but a big part of the vaccine piece to me is also the testing. And just broadly speaking, we started testing, we tested our first patient on March 16th. And as of today, we've nearly tested 12,000 individuals. To that point, we are doing the test over test, as kind of articulated when I say the data here that Dr. Orr mentioned. And with that being the case, about 69% of the individuals that we have been tested, because we wanted to be intentional about people of color, we stay true to that to make sure that those individuals have access to testing. So we've been making sure that was available to the broader community. And then we've had a positivity rate since the onset of the pandemic, about 15.8%. I will say that our 7-day rolling has decreased, very similar to what the county has been experiencing. And as of this morning, we're sitting at about 5.3. So while testing has gone down, we have seen some improvements overall in the positivity rate of the individuals that we've been providing testing to. So that is, again, just speaks to the efforts around protections and ultimately doing everything we can to keep the community safe. On the vaccine front, we actually, again, have been working with the state and working with the county, and we began vaccinating our employees about the latter part of December. And so the way that things have really been going, and again, I want to give credit to Dr. Poore and Kerry Kernan and everyone in terms of communicating, and it has been an exercise of transferring vaccines here and going there and getting direct shipments and all of those things. So it's been a very complicated process, but yet we are getting vaccines into arms. And so our current plan and strategy is that we have the ability to vaccinate individuals that are 65 and older, or those that are 18 to 64 that qualify under the high-risk medical conditions category. And working with the state of Nebraska, they have given the FQHCs the ability to vaccinate that population in terms of our patients because of the complexities and the vulnerabilities of those groups. And so immediately Charles Drew started reaching out to all of our patient base that met that criteria, and we nearly served about 16,000 individuals this past year. to not only screen and determine whether or not they want the vaccine, but would have the availability to get scheduled and get in to get the vaccine. We are running kind of vaccine clinics for the Charles V patient base at our location on the campus of Omaha Home for Boys. It's located roughly about 52nd and Ames. We chose to use that satellite site because it gave us a couple of opportunities in terms of accessibility for the population being on the bus line, but also it put us in a position as an organization to be able to meet the needs without having to create disruptions at our main site. And so for our health center, we have been providing that location for the general population that are patients to be able to get vaccinated. So the data that I'm going to share with you today is relative to not only the employees that we vaccinated, but also the patients that we started vaccinating at the early part of February. So we provided over 772 first doses. 154 individuals have received their second dose. And again, that's inclusive of the community members and patients that fit the priority group along with our employees. Starting next week, we will be running clinics on Monday, Wednesday, Friday, and Saturday from 8 to 5, and then Tuesdays and Thursdays from 11 to 8. Again, that gives us the availability in terms of timing to reach the needs of the patient base because we know that many folks are working or have challenges with the traditional hours, so we felt that was best for us to make that available to our patient base in the community. And so we will continue to vaccinate as many vaccines as we can get in. And working with the county and working with the state, our health center has been receiving, or we will receive, nearly about 300 a week. I will say we have the capacity to have a throughput of about 900 to about 1,000 a week. So as availability becomes as supply becomes available, we will continue to rev up to try to meet the needs of the community. Many of the challenges that we're having is well documented, obviously relative to questions about the vaccine. Also, some of the traditional barriers that you may have for individuals that are seeking health care. So again, transportation, language barriers, gaps in technology, things of that nature. So our team is working extremely hard to make sure that we alleviate anything that can contribute a problem from someone who wants to get a vaccine to be able to get the vaccine. So in closing, there are some, and Dr. Ford mentioned this, that we do expect that the community health centers in the state of Nebraska will be participating in a direct allocation program from the federal government. As of today, I do not have any information on which community health centers have been assigned as part of the initial pilot. What we do know that there will be a phased-in approach, and again, the direct allocation that will come to the community health centers will complement and augment what is already coming into the state during the regular state meeting. And so we believe that's going to be a great opportunity. As many vaccines as we can get in, the more the better. Definitely encourage about the possibility of the Johnson & Johnson product. I will say that Charles Drew is operating with the Moderna product right now. And so over time, as we start to get additional supplies, we'll continue to keep meeting the needs of the community. So again, just want to give my appreciation to the leadership of Douglas County, as well as the Board of Health, on the stance that we've been taking in making sure that people within the community have access, not only from a testing perspective, but also on the vaccine front. I'll take any questions.
No questions, Ken. But explain to me the pilot, you say that the Fed is on a pilot phase.
Yeah, so with the president and the new administration recognize and acknowledge the role that community health centers play across the country, and as we know, very similar to the pharmacy program, that there still are gaps in areas across the country with individuals being able to get to the vulnerable population, and specifically the role that we play in terms of serving people of color and a disproportionality in terms of impact. So to try to alleviate some of the challenges from a logistical standpoint, they have assigned or will be phasing in a number of community health centers across the country to receive direct allocations to start vaccinate the population in which they serve. They're going to be starting off probably about 25 FQHCs and then ultimately get to at least one FQHC in every state with the goal of trying to get a direct allocation for every community health center in the country as supply starts to increase. So we will, don't know exactly which health centers will be assigned at this point, but we do believe the 7 FQHCs in Nebraska will be able to receive a direct allotment as this program continues to phase in and we work out the kinks.
Okay, I think that's all we got. Thanks. Andrew, are you on?
I didn't. I'm here. Okay, that's Andrea Jones. I don't think she's on.
Yours is gonna come to you next.
All right, thank you. Good morning, everyone. And again, I want to express my sincere appreciation to the Board of Health, Dr. Poor, and our partners in the community as it relates to this pandemic, and particularly representing the African American community and the churches specifically. We're anxious to get back. We're anxious to get everyone vaccinated, and to the point that I asked my husband to serve as one of the leaders individually on his own to talk about this issue from his perspective, and he has done, I think, a great job in doing that. But before we concentrate more on the vaccine, I wanted to get a little history on terms of where we were with our COVID testing. Dr. Poor and I have been discussing initially why it was taking so long for African Americans to get tested. While they were trickling in initially, it was just taking such a long process. And so for me, in order to look at action plans, we need to collect the right data. We needed to go to the community and ask them, why aren't you getting tested? What is the problem? What is the holdup? Do you know about the test? So I solicited the help of a grad student from Creighton University. His name is Joey Wetchup. He's an MPH at Creighton, and he really helped a lot. He had a learning curve also in terms of the African American community, and now the surveys would have to be done virtually. No more sitting around the table, close up, and all of that business. That everything have to change in terms of our survey methods. And so we were learning together in terms of what possible outcomes there might be. With the issue at hand and trying to figure out why it was taking such a long time, it entailed surveying and interviewing members of the African American populations in Omaha. We interviewed about 100 people. I don't know if you have the slides, Sunday, ready to go?
I don't have the slides.
Okay, so let me just do it this way. I'll just talk briefly. So there were 100 surveys and 10 interviews were conducted because we wanted to do, get some in-depth information via interviews, and the demographics and the age and the participation was captured, and a formal report has been submitted to Douglas County. Out of the 100 participants, there were 29 males and 71 females, and 22% of the participants were from the 50 to 60 age group. 47% of the participants reporting having 2 to 3 people in their household, while 4% reported having 7 or more. Out of the 100 participants, 59 reported that they did get tested. And out of the 15 participants who reported others, 7 reported none of them got tested for COVID-19. 5 reported 7 grandchildren got tested, 1 reported another son got tested, 1 reported another son got tested, and 1 reported a daughter-in-law got tested. Almost everyone is aware of the COVID-19 testing sites in their communities, although there were only 7 reported that they were not aware of testing sites and of their availability. It's still a health concern, obviously. Only 96 participants answered this question in terms of the number of COVID testing sites. Although a majority definitely and probably knew the location of the testing sites, 20 were unsure of where they were located. The word of mouth, we asked, how did you know about COVID-19 testing sites? How did you know where they were located? And the word of mouth from families and friends, as well as church and social media outlets, played a big role in spreading the word on where the testing sites were available. Out of the 21 who responded with others, 1 reported Apple Maps. 2 talked about billboard signage. There was discussion about Creighton University. Myself reported driving by and saw testing sites. Reporting internet, Google reported the Empowerment Network ambassador, schools, Test Nebraska, and 3 did not respond. When we asked about if they were aware that the testing was free, although there's a strong consensus that COVID-19 testing is free, quite a few of the participants disagree that it was actually free. Out of the 96 people who answered the question not tested for COVID due to fear of results, 96 who answered this question, 62 strongly agreed to the statement, I have not gotten tested because I fear the results. When we asked the question, did you not get tested because of lack of health insurance? 73% of the 96 who answered the question strongly disagreed that lack of health insurance was a barrier. We asked the question, were you not tested because of lack of transportation? And 83 strongly agreed that lack of transportation is a barrier for getting tested for COVID-19. Not tested for COVID due to lack of childcare. 84 strongly disagreed that lack of childcare was the problem. What about not tested due to lack of symptoms? Quite a number of the participants agreed that lack of symptoms is why people are not getting tested. A majority of the participants were aware of getting COVID tests even without symptoms. A majority of the participants agreed that they were aware that they should be testing even if they do not have the symptoms. We also did a little bit more deeper dive, and by the way, the report can be distributed to each of you so you can get even more details. But in the interest of time, I want to share this information with you from the deeper dive with the interviews. We separated folks into 2 groups, those who were tested and those who were not tested, to assess why it was taking a lot longer for African Americans to get tested for COVID-19. We did really just 10 interviews. They were all online, by the way, all by phone. And so those who were tested for COVID and those who were not tested for COVID. Random sampling methods were then utilized to pick 5 from each of the groups that got tested and those who didn't. The reasons for getting tested, they said they got tested because of the Test Nebraska initiative. They know someone who has been exposed to someone with the virus because they worked in a nursing home or because there were free tests at Salem Baptist Church. They started coughing and suffering from asthma and COPD. The testing site perhaps was nearby and the line was not too long, and they suggested and offered at church. It was suggested and offered at church. The reasons for not getting tested: they were afraid of the test, very sensitive nasal cavity. They were already self-quarantining themselves and avoiding getting exposed from their perspective. They were not exposed to anyone or in any close proximity to anyone who may have been tested or been exposed, excuse me. They didn't feel the need to get tested. Strict regulations at workplace to wear masks all the time, so they felt that was protecting them. There were no symptoms, a lot of that. Have not gotten around to doing it yet. The line was too long. And then Some thought they were protected because they simply work from home. We asked the question, it was important for us to know a little bit more. How has COVID-19 pandemic impacted your life? The responses were lost job, unemployed, can't go to the movies anymore, activities are limited, pregnant and difficult going to stores and around to other places, not able to help elderly friends get their groceries, take them to beauty shops and church activities, staying in all the time due to asthma and COPD and other health conditions, not able to go to church, restaurants, travel, visit family and friends. The other responses were blessed to still be employed, be financially stable, work from home, and stay safe, able to take care of sick family members. Switching to online classes for some of our African American students, it's challenging. Great toll on mental health. Wearing masks and being conscious about everybody else wearing their masks, going out and about, and limiting the number of people they were around has impacted them. And they're very conscious of wearing masks and social distance and washing hands. So it wasn't necessarily negative impact. Some was positive. When we asked this group why they thought it was taking a lot longer for African Americans in particular to get tested for COVID-19, they said the following. Some people don't know about the testing sites, which bears out what our results said. They do not have easy access to the internet. Recall at the time people had to register ahead of time, and you just couldn't walk up, and you weren't always, unless you had symptoms. People are working all the time. The way they do the tests is what drives people away. Tests are painful and uncomfortable. A lot of people cannot get to the testing sites. This is what they thought. There are not enough testing sites around. They do not want to know if they are ill. How the tests are portrayed in the media, lack of transportation, someone said. Governor does not want testing to occur. They did not roll out testing until recently. You cannot just roll in and get a test. You have to get on the computer and sign up for one. At one point, they were saying that if you do not have symptoms of COVID-19, then you do not have to get tested. There's not been a real plan by our leaders to have testing done. Do not know someone close who's been affected by it. Lack of education and awareness, and they do not regularly watch the news. That's what during our interview. When I'm asked during the interview, how would you address this issue? What do you recommend how to address this issue? Of course, people talked about communication, flyers and mailings and testing with a list of testing sites and times that they are open could be shared with community members, could notify community members that the tests are free, at least at some locations. Statewide mask mandate, a national strategy. We need more testing sites. We need another way of taking the test. The word of mouth, convince more people. I have been tested, it does not hurt, it is quick, it is free, and you need to get tested. Make registration process simpler and easier. Reduce barriers to access and open up more testing sites. Go back to phase 1 of lockdown, where people cannot do a lot of things, curfew in place and city shutting down. Constant information on the avenues people go to, such as social media, news, billboards, and stores. It needs to be aware where people can go, whether it is free or insurance driven. Have funding for either taxi service or Uber to pick up individuals and take them to the testing sites. People need to be educated on the importance of seeking health care starting at an early age. So the recommendations based upon the interviews and the results that we gathered, obviously dissemination of COVID-19 testing site information into the public in a more effective manner, open up more testing sites with flexible hours, awareness and education in communities on COVID-19 and positive portrayal of how the test is done, share stories of people who have gotten tested and who have recovered from the virus, and make registration process simpler and accessible, and the statewide mask mandate to control the virus. So that was a grassroots survey that was conducted, and including grassroots recommendations and suggestions. Are there any questions for me? Yes, we'll make sure. Carrie has a copy of the report, and she has a copy of the stats as well.
Based on listening to what Doris has talked about and others, do we know how many African Americans, because that number continues to be a lower number than you see across the country? Are we testing appropriately, or is there some kind of data that reflects how many African Americans specifically are being tested in comparison to the numbers of African Americans in the city?
Correct. The number of tests that have been done, I don't think we have that information. We have the number of cases by race and ethnicity. So I think Kenny and I often have the discussion, have there been, what's happening in Omaha in regards to African Americans, because we are seeing less effectiveness, less people being affected by the virus. So I try, my glass is always half full, and my answer is always, it may be that our African American friends in Omaha, Nebraska are doing non-pharmaceutical interventions better, and therefore the case load is less.
My second question goes back to the schools again, because I get a number of emails specifically about Mars Magnet Middle School, because that's where a lot of Hispanic students go. That's where some of the highest numbers were. When you're prioritizing, and I understand the difficulty with school districts. I mean, we have a city that has 5 public school districts in it, and that in and of itself is challenging. But Mars, how do we, when we're going to distribute to teachers, are we going to do it with some of the highest numbers of people that have tested positive, like say in Mars Middle School?
So we had a lot of discussions with the superintendent's office. How is this prioritization? If we have very limited vaccine, how are we going to distribute this fairly and equal and equitable across Omaha? And the final discussion point was that the superintendents with their HR people, they are going to prioritize based on age and underlying honors. And so then they are going to come up with their list of individuals who fit into those groups. They are going to provide them, and we then are going to vaccinate depending on the percentage of students enrolled in that school district. So, OPS, if they have 50% of all of the students enrolled, they would get 50% of that 10% allotment that week. And then we'll give it to the schools. And we also determined that in the beginning, when we have very limited vaccine, that we were going to focus on K through 12. Because higher education is also in that, but we thought the focus needs to be on K through 12, following the American Academy of Pediatrics, who really identified the need the importance of in-person
Thank you. Thank you, Mr. Chair. Good. All right, are there any questions for the reports of this one? Okay, seeing none, then we will, any board or, committee members update the reports? Do you wanna do your?
Sure. So we're, if you recall back in September, the board decided to start a health equity committee. So we've been in the process of, and will begin interviews for community participation in the health equity committee. So we have some interviews that are occurring this week and next week, with recommendations for voting members being brought forward in March. We then will, once we have those voting members on the committee, we will then start adding ad hoc committee members that will be available to the broader community.
With that, seeing no questions, we do need an executive session. And so with that, it is 9:25, and so I would ask for a motion